Welcome, future CNAs. Let's get right into it. We're going to be talking about bowel elimination, which is honestly one of the most important parts of providing amazing, dignified care for your residents. All right, here's our game plan. We'll start with how digestion even works, then we'll jump into what you need to look for and how to report it. After that, we'll cover the common problems you'll see, what you can do about them, and we'll finish up by taking a closer look at enemas. First things first, the digestive journey. To really get what can go wrong, you've got to understand how it's all supposed to work. So let's follow the food, shall we? Okay, so the digestive system, it's not just one thing. It's a whole team of organs working together. Their big job? Break down food, pull out all the good stuff, the nutrients, and then get the leftovers ready to be, well, eliminated. So how does everything move along in there? It's not just gravity, that's for sure. The intestines have this incredible, involuntary muscular action called peristalsis. The best way to picture it is like a wave, a series of muscle contractions that just keeps pushing everything forward. So, the whole trip starts in the stomach. Food gets all mixed up into this substance called chyme. From there, it heads to the small intestine, which is where all the nutrient magic happens. Finally, it goes into the large intestine, and that's where the water gets pulled out, and what's left over becomes stool. Now, let's talk about you. This is where your role becomes absolutely critical. As a CNA, you are on the front lines. You're the eyes and ears of the care team, and what you notice about a resident's bowel movements is just invaluable. Yeah, this image is a bit funny, I know, but the point it's making is dead serious. A person's bowel movement is a huge clue to their overall health. You should honestly think of it as another vital sign that you're responsible for tracking. Now, to report what you see, you've got to speak the language. Let's make sure we're all on the same page with these terms. Diarrhea, that's frequent liquid stool. Constipation, that's when it's infrequent and hard to pass. Fecal impaction, that's a really serious blockage. Flatulence or flatus, just a professional way to talk about gas. And fecal incontinence, that's the inability to control the bowels. You'll be using these exact terms when you talk to the nurse. It is so important to know what you're looking for, what's considered normal, and this is it. A typical healthy stool is soft, brown, and moist. This is your baseline. This is what you'll compare everything else to. But of course, normal can look a little different for everyone, right? It's influenced by so many things. What they're drinking, what they're eating, their meds, how active they are. You're going to get to know each of your residents and learn what their unique normal pattern is. Okay, let's dive into the two biggest issues you're probably going to see: diarrhea and constipation. We need to know what they mean for your residents' health and what you need to do. This picture explains the problem with diarrhea perfectly. See on the left, that's the colon absorbing just the right amount of water, making a nice, formed stool. But on the right, that's diarrhea. Everything is moving way too fast, the colon can't absorb enough water, and you end up with liquid stool. When a resident has diarrhea, you need to act fast. It's on you to watch them closely for signs of dehydration, use your infection control training, be super gentle with skincare to prevent breakdown, and, of course, tell the nurse right away. And on the flip side, we have constipation. This happens when the stool is moving too slowly. The colon basically has too much time on its hands, so it just keeps reabsorbing water until the feces gets hard, dry, and really difficult to pass. Now, it's really important to know the difference here. Simple constipation is one thing. A fecal impaction is a whole other level of serious. That's when the stool becomes a hard, stuck mass that's blocking everything. It's a true medical emergency. This quote says it all, doesn't it? Fecal impactions are almost always preventable. And who's the number one defense? You. Your consistent, proactive care. Pushing fluids, encouraging fiber and activity, that's what stops this painful condition from ever happening. So let's build on that. Let's really focus on the proactive, hands-on things you can do every single day that are at the very heart of your role in promoting good bowel health. I want you to think of this as your daily bowel health checklist. These 6 things, they make a huge difference. Encourage fluids, that keeps things soft. Encourage fiber, that adds bulk. Help with exercise, because movement gets the bowels moving. Always ensure privacy. And of course, answering those call lights quickly and reporting any issues right away, that's about respect and smart early intervention. Okay, sometimes you'll be asked to do something more specific, like collecting a stool sample. To do that, you'll use a neat little gadget like this, which everyone calls a toilet hat. It just fits right inside the toilet bowl to catch the specimen. When you're collecting a sample, the number one rule is to get it right.
You need an accurate result, so always give the person a heads up and make sure the sample is clean. And that means absolutely no urine and no toilet paper mixed in. That stuff can totally mess up the lab results.
Last but not least, let's talk about enemas. This is a procedure where fluid is put into the rectum to help trigger a bowel movement. Now, depending on where you work and your training, this might be something you'll assist with or even perform yourself. This slide shows you two really important things you need to know. First, look at the positioning. The patient should be on their left side. That helps the fluid flow into the colon the right way. And second, you can see the kind of equipment you'll typically be working with. Safety is everything. First rule, never, ever give an enema without a doctor's order. Then, follow this checklist every single time. Get the positioning right, use warm water, never hot, never cold. Protect the bed with pads, and have that bedpan or commode ready to go right then and there. So as we wrap up, I really want you to think about this question. Your job isn't just about reacting to a mess. When you pay close attention every single day, you actually shift from being reactive to being proactive. You stop problems before they start, and that simple, consistent diligence, it goes straight to the health, the dignity, and the comfort of every single person you take care of.